Hi, welcome to Med Daily. Today's segment is dedicated to the new research of gene therapy used in immunodeficiency, specifically the perilous disease SCID, standing for Severe Combined Immunodeficiency. It is a rare and dangerous disorder caused by mutations in the genes involved with the development and function of infection-fighting immune cells. New gene therapy methods for treating SCID have shown success for people suffering with the disorder. Over at Stanford University, Dr. Sophie, MD and immunologist, informs us of the important functions of the immune system.
Over the years, I have dedicated my life to the exploration of the human immune system and how problems with it can lead to immune diseases such as SCID. There are three main types of immune disorders: allergic diseases, which are when the body overreacts to a seemingly harmless material; autoimmune diseases, which are when the immune system mistakenly attacks healthy cells in the body; and finally, immunodeficiencies, which are when the immune system is compromised and may be lacking certain antigens. Immunodeficiencies can be inherited genetically, acquired throughout one's lifetime, or acquired through the use of immunosuppressive medication. To recount, the National Institute of Allergy and Infectious Diseases states that the immune system is a system of cells and proteins that helps individuals combat disease and infection. When the immune system senses danger, or danger-associated molecular patterns, also called DAMPs, it releases B and T cells to attack the dangerous cells. Individuals that are affected by SCID are not able to produce many T cells, and their B cells do not function, so they are very susceptible to dangerous and even fatal infections.
Wow, that is so interesting. Thanks for taking the time out of your day to tell us about this. Now on to Dr. Natalie Bermenschneider, a renowned geneticist at the University of Chicago, who will talk to us about what gene therapy really is.
Gene therapy is when stem cells are extracted from the patient's bone marrow, injected with healthy genes using a carrier known as a vector, and inserted back into the patient. Through extensive research, we are proud to report that we have found a way to restore immune function in infants with SCID by using gene therapy. Our earliest attempts at using this technique appeared to cause leukemia. However, as our research continued, we were able to find ways to make it safer. In our most recent studies, 10 infants were treated with gene therapy, and after 16 months, all but one of the infants saw climbing levels of T and B cells. As a result, 4 of the patients were able to receive vaccines, which allowed them to leave isolation. These results are very encouraging, as they show us that gene therapy may be the best option to treating this horrible disease. Before this treatment option, patients with SCID had to have a bone marrow transplant, which is much more invasive. The vector in gene therapy can be injected or given by IV directly into a specific tissue in the body, where it is taken up by individual cells. As a result, patients have less scarring and their bodies can quickly recover from the operation.
Thank you, doctor, for explaining the process of gene therapy to us. Now over to Marley Brackett, a patient who has suffered through her journey with SCID and now a current recipient of gene therapy that is curing her condition.
When I was little, I suffered from a severe case of SCID. Since it is not easy to tell if an infant has SCID, I grew up with the disease and began to see the hospital as my second home. My parents began to notice something was wrong when I kept getting ear infections and pneumonia. The doctors didn't think anything of it at first, but with my parents' persistence, the doctors looked into it more. And at the age of 5, I was diagnosed with severe combined immunodeficiency. I was forced to grow up in isolation from then on because even the smallest paper cut could cause me to catch a deadly disease. Ever since I received gene therapy, my quality of life has improved drastically. I can now go outside and hang out with other people my age and enjoy the rest of my life.
What an inspiring story. Thank you, Marley, for sharing your experiences with us. That's all for now, folks. Thanks for watching this segment of Med Daily.